Hi, I'm Heather Monroe. I'm the Director of Senior Services at the Wellesley Council on Aging. I'm here today with Judy Gertler, who is a Senior Medicare Patrol volunteer, and we're here to talk about an upcoming program on April 27th at 11 a.m., Preventing Healthcare Errors, Fraud, and Abuse with the Senior Medicare Patrol Program. Before we get started, Judy, can you tell us a little bit about yourself and why you became a volunteer?
Sure. I live here in Wellesley, and I am a Medicare beneficiary. When I retired, my husband and I had to go on Medicare because I would no longer be covered by my employer's health insurance. So I became more aware of things that I was hearing on television about Medicare and in reading in the newspaper. And I started to see things about people making fraudulent claims against Medicare, specifically healthcare providers such as physicians, nursing homes, durable equipment providers. Then one day, I got an email from AARP describing the Senior Medicare Patrol Program and announcing that they were looking for volunteers. It said that one of the things that they do is educational presentations. And I thought, this is something that I probably could do because I did a lot of it when I was working. So I signed up, and here I am 6 years later, still a volunteer.
Thank you, Judy. And can you tell us what exactly is the Senior Medicare Patrol Program and what does it do?
Okay, it's a federally funded program, and it's designed to educate Medicare beneficiaries, their families, their caregivers about problems having to do with errors, fraud, and abuse with Medicare. And here in Massachusetts, we take it one step further. We want to make all of these people informed, engaged healthcare consumers.
And what is the estimated amount that is lost due to errors, fraud, and abuse?
The most conservative estimate is $60 billion. That's 60B with a billion. I've seen estimates as high as 90 billion. To put this in perspective, the entire Medicaid budget is about $800 billion. So we're talking, in the neighborhood of maybe 8 to 10% of the Medicare budget going to things that didn't happen or shouldn't happen to any of us.
And how is the Senior Medicare Patrol Program funded?
It's funded by the Administration on Community Living, which is part of Health and Human Services. And every state gets a grant, every state plus Puerto Rico, Guam, Virgin Islands, and DC. And the grant funds several full-time employees. Here in Massachusetts, it's 3 people. But most of the work gets carried out by volunteers like me.
Okay. And if the Senior Medicare Patrol Program office receives a complaint of possible fraud, abuse, or errors, what happens?
Okay, the first thing is the individual would call the office, and somebody there would review it and see if it's something that's within our power to deal with. And if it is, the individual would be asked to sign a release allowing us to contact Medicare on their behalf and to access their Medicare information.
Do you have any recent examples of possible fraud, abuse, or error complaints that have been made?
The most common complaint in the last 2 years had to do with orthopedic braces. There were a number of telemarketing companies that would contact Medicare beneficiaries and say, you have pain. Well, all of us have some kind of pain. And if you said you had back pain, they'd say, well, we have this great back brace that we can send you. It won't cost you anything because Medicare will pay for it. And lo and behold, some brace would show up, and it might not have fit the person, whatever. And then the individual might have started receiving additional braces, which they had not asked for, didn't need, whatever. So this was a common situation that we dealt with. Basically, the people wanted to return this stuff, and they didn't want Medicare to have to pay for it.
How long does it take to resolve a complaint?
It depends how complex it is. If it's something that just involves an error in a bill or the individual feels it's something that Medicare should have paid for and denied the claim, those can be resolved fairly quickly. We've had some cases that have gone on for as long as 2 years because they were far more complicated.
And how does the Senior Medicare Patrol Program inform people about its mission and services?
Well, we have people go out to healthcare fairs, but probably the most effective way and the most common way that we do it is through presentations like the one that I'll be doing here in Wellesley on April 27th. I've given the talk 3 times before, but even if you've come to one of my other talks, I suggest that you come again because there's always new information and you'll probably learn something from the new information that I didn't have last time.
Okay. And if people have questions before the April 27th presentation, who do they contact?
Okay, they can call Senior Medicare Patrol directly at 1-800-892-0890.
Okay, thank you, Judy, and we hope to see everyone on April 27th at 11 a.m.